Changes are being planned all over the country for our National Health Service, which are going to have profound implications for the quality of health and the availability of both primary and secondary services and the size and location of our hospitals. There's been justified criticism of the secrecy and way in which this process of so-called sustainability and transformation plans has been carried out. The Department of Health has produced a 5-year forward review, and it's also produced very large numbers of plans. I wish to focus in this debate on the North East London Sustainability and Transformation Plan, draft which was published on the 21st of October, and the 8 delivery plans to supposedly implement that. Yes, of course.
I thank my honourable friend for giving way. Can I just put on the record my personal gratitude to him on behalf of all the residents of Walthamstow, because we know that these plans are not going to be subject to parliamentary scrutiny. So the fact that he has secured this debate today may be the only opportunity we have in Parliament at all to look at something that will fundamentally transform their local healthcare services.
Thank you. I'm grateful for my honourable member, honourable friend, who she spends a great deal of time, as I do, campaigning with her local council to improve the NHS locally. And we are all, throughout our region, our sub-region of North East London, very concerned about what we are facing. The King's Fund reported in November that the speed of development of these plans has been such that patients and the public have been largely absent. And that NHS England has instructed that freedom of information requests should be actively rejected. And locally in North East London, a request for the financial and working detail of the STP was rejected in November on the basis that, quote, disclosure would be likely to inhibit the ability of public authority staff to express themselves openly and explore extreme options. Deliberation needs to be made in a safe space to develop ideas and to reach decisions away from external interference which may occur if there is premature public or media involvement. My own council, the London Borough of Redbridge, has been very concerned that they've not been adequately involved in this process. They've made clear to me that they are going to act in the interests of our local community, and they have said that Redbridge will not be signing off or endorsing the STP unless we are satisfied that it's in the interests of Redbridge residents. I understand that the STP programme boards are not required to hold meetings in public, and no agenda or minutes are published. And the secrecy surrounding this process has not helped to build public trust and has caused suspicion within communities of all over the country, but particularly, I speak from local experience, as to the intentions of the proposals. In many respects, what could be a reasonable response in the circumstances to the crisis that we face in the future funding, the ageing population and other challenges to the NHS is being undermined because of process issues. The National Health Service needs to learn from these experiences about how better to engage with the public and key stakeholders, including elected local representatives. We are fortunate in Redbridge and in North East London because there are good relationships, working relationships, within the NHS and local government. And there is a model already of collaborative working. But the problem with the STP is that it brings a top-down process into this situation and potentially undermines that joint working that has voluntarily been established over recent years. Redbridge, along with neighbouring authorities, will be strongly arguing that the developing STP governance structures should not stifle or negatively impact on the local work that is happening. Redbridge and its partners in Barking and Dagenham and Havering have over a number of years been developing cross-borough collaborative approaches on integration of health and social care. And Redbridge is arguing that STP governance needs to ensure this subsidiarity to local level is taken as a model for the future and not undermined by the STP approach. We need to ensure democratic accountability if we are to get public buy-in, and we do not have that at present. Public engagement needs to be enhanced and improved. The North East London October STP draft, which I have here, is subtitled Transformation Underpinned by System Thinking and Local Action. It says, however, that system partners may not be able to work together collaboratively to deliver the plans. And today we've seen the news about the reality that we face in our NHS. Large numbers of hospitals with dangerously high bed occupancy levels, little or no flexibility. The CQC's chief executive recently talked about hospitals being dangerously full. And on the 26th of November, a leaked memo from NHS England revealed that hospitals were being banned from declaring so-called black alerts and were being told to prepare for the winter crisis by passing on scheduled surgery to private hospitals and discharging thousands of patients in order to get the bed occupancy levels down to a lower percentage from on average nationally 89 to 85%. Yet, we also know that in North East London, we have a massive increase in population. This report says that the population in the North East London boroughs is going to increase by 18% in the next 15 years. That's equivalent to a new city. Yet, there's no plan to have an additional hospital to cope with that. In fact, the report itself says on page 20 that building an additional hospital is, quote, not practical or realistic. Indeed, it's worse than that, because there's not only no extra hospital coming, there is a planned closure of the accident and emergency at King George Hospital in my constituency. Overnight, ambulances are planned to stop sometime next year. And there is still planned to be a total closure of the A&E in 2019. This is required by the STP, both because it generates some savings and restructuring requirements, but also because they have unsustainable costs, which I will come on to. The former Health Secretary in 2011 announced that there would be a closure of the A&E at King George in around 2 years. Well, that hasn't happened yet. It's not deemed safe to do so, and there is not the capacity at Queen's Hospital in Romford or at Whipps Cross Hospital in Waltham Forest in order to cope with those increased demands. And despite our excellent hard-working staff, all the hospitals in North East London are in crisis, with pressure for early discharges, but inadequate social care and lack of community services and support. We have bed blocking on a big scale and delayed discharge. And of course, you get readmissions of sick patients who don't manage to get proper treatment because they can't get appointments at GP services because of the pressures that we all know are existing in the GP sector. Out of hospital and integrated community care is seen as the way forward in the STP. But we know, and I quote the words of Dame Julie Moore, who chaired a commission in 2014, as much as it suits us all to have one nice, neat solution to the problem of our growing, ageing population, the truth is that as a catch-all answer, it is simply wishful thinking. Integrated community care is a good thing, but this can never be a substitution for hospital care. We still need hospitals, we still need acute care. Plans to transform care in the community are very good, but it requires a transformation of primary care, and that needs a resourcing. The STB projects a 30% shortfall of nurses by 2021. We know that large numbers of GPs are planning to retire in the next few years. And these are very difficult issues. There is also a problem with the potential financial situation. One of the issues that is confronted here is an estate's strategy. They are planning to sell off part of hospital sites, including Goodmayes Hospital, which is a large mental health hospital, and King George Hospital in my constituency are highlighted as areas where land could be sold. But there are contractual issues, and there are other matters that means that this is probably an optimistic approach. Yes, briefly.
I thank my friend. He's making an incredibly powerful case about why we must involve the public in some incredibly difficult decisions. We know the financial situation we're facing is particularly dire. He's just mentioned the sites at Goodmayes, also at Whipps Cross, which has a large PFI debt. It's paying out a huge amount of money. No wonder they're suggesting we need £578 million to bridge the gap.
She's given the figure that I was about to quote. The STP executive summary, quote, "Our total financial challenge in a, quote, do-nothing scenario would be £578 million by 2021. Achieving ambitious business-as-usual cost improvements, as we have done in the past, would still leave us with a funding gap of £336 million by 2021. These are eye-watering figures. And although it's claimed that we have identified range of opportunities and interventions to help reduce the gap significantly, this £240 million gap between the usual business case model and the actual predicted figure requires a series of other measures, including a significant funding from the Sustainability and Transformation Fund, reductions and changes into specialised commissioning, and what is called, quote, potential support for excess PFI costs, which covers Whipps Cross Hospital, which covers Queen's Hospital, Romford, King George Hospital to some extent. Potential. What a lovely word. Not real. Not even planned, just potential. These plans are based on unrealistic, indeed heroic, Soviet-style assumptions. A truly Stakhanovite model of overestimation of potential. Yet the STP still proposes it can transform a deficit of £578 million in 2021 to a potential surplus of £37 million and improve the services. This will not happen. It's also predicated on totally unrealistic assumptions about savings from closing the A&E services at King George Hospital and lack of clarity of when and how much. Tens of millions, I have been told, would be invested in the sites at Queen's and Whipps Cross. I've been told 75 million at least is needed to do that. There is no sign where this capital is coming from in the Department of Health. So you close wards in one hospital and then invest millions in rebuilding wards or constructing wards at other hospitals for no real net gain. There's also a problem about what process will be involved in this closure of King George's. I'm conscious I don't have limitless time, but my council in Redbridge is very concerned that as King George is supposed to be transformed from an acute hospital into an urgent care centre, the local community needs to be involved. Redbridge is requesting that they should be involved, and I noticed that recently there has been an agreement that they will be involved on the Transformation Board, but they want an independent chair of that board because it's important that a person of public trust is there so that there is no controversy. And there needs to be a transparent, open process as we discuss the options for the future of King George Hospital, to challenge the business case and to take account of the fact that the assumptions on which this model is based are 10 years old. They go back to the so-called misnamed Fit for the Future plans of 2006. The population growth that we've had and the population growth to come and the young population that we have in the area and the moving population means that we have to look at these issues with great doubt and concern. We need to look out and assess adequately the implications of all these issues. And as Redbridge says, they want to also note how the reconfiguration to an urgent care centre assists the primary care, community health services, adult social care, and also public health and public health prevention and education. We have an opportunity in the changes that are there, but they need to have public engagement, and we don't have that. There will be enormous pressure on my local council because of budget problems, and I am worried about the situation. I'm glad the STP highlights the social care challenge. However, this needs to be taken seriously by the government if we are truly to have an effective health and social care system. The statement we had in this House yesterday is not a solution in my borough. It doesn't answer the challenge that boroughs such as Redbridge are facing, boroughs that are already ahead of the game in terms of integration of health and adult social services, boroughs that are working with neighbours to take up the challenges through being a pilot for the development of an accountable care system. Yet with all this transformation, Redbridge still faces a huge social care challenge, and that's made worse by a triple whammy of public sector funding reduction to local government, and my borough has lost 40% of its income since 2010, chronic underfunding of adult social care by the government, and the fact that my borough, Redbridge, does not get a fair funding level in the first place. And so we face a situation where there is potentially a major problem. We face a shortfall of about £4 million on social care, and an extra 1% on council tax raises less than £1 million. Responses we heard from the government in recent days have been inadequate, indeed could be worse even than the silence we had from the Chancellor in the autumn statement. They offer no real solutions to the real growing crisis that will impact some of the most vulnerable in our society. I will conclude with this plea. Please, can the government look at the situation in North East London, and can the Minister meet with me to discuss the fact that this plan is unrealistic, incredible, cannot be achieved and will lead to disaster.